Alright, let's talk about sexual dysfunction. So there are sexual desire disorders, sexual arousal disorders, orgasmic disorder, sexual pain disorder. So for sexual desire disorder, hypoactive sexual desire is the most common. It peaks 40 to 60-year-olds associated with situational circumstances and antidepressants. Treatment is psychotherapy and antidepressants when associated with anxiety. There's also sexual aversion. For sexual arousal disorder, it's usually the lack of 3 of the following for 6 or more months, including interest in sex, sexual thoughts or fantasies, initiation of sex and responsiveness to partner initiation, excitement or pleasure during sex, interest or arousal in response to internal external sexual cues, genital or non-genital sensation during sexual activity. Sexual arousal disorders, 3 of the following. It's commonly associated with SSRIs. Orgasmic disorder, about 5%, lasting 6 months and causing significant distress linked with hypoactive sexual desire disorder. Sexual pain disorder is 6 months of one of the following: difficulty having intercourse, marked vulvovaginal or pelvic pain during intercourse or penetration attempts, marked fear and anxiety about pain, marked tensing or tightening of the pelvic muscle during sex, dyspareunia, recurrent or persistent genital pain associated with sexual intercourse that is not caused exclusively by lack of lubrication or by vaginismus and causes marked distress and or interpersonal difficulty. Recurrent or persistent genital pain associated with sexual intercourse that is not caused exclusively by lack of lubrication or by vaginismus and causes marked distress or interpersonal difficulty. Pain disorder that interferes with sexuality rather than a sexual disorder characterized by pain. Common in the most postmenopausal women, up to 20%. Reflective of provoked vestibulodynia, inadequate lubrication or vaginismus may improve after hysterectomy. And then vaginismus, recurrent or persistent involuntary spasm of the musculature and the outer third of the vagina that interferes with sexual intercourse, occurs when pain is anticipated, linked to hypoactive sexual desire disorder and sexual aversion. Muscle responsible usually is levator ani and the bulbocavernosus. So sexual pain disorder is these 3, so 6 months of the following that we talked about earlier: dyspareunia and vaginismus. They're all part of the sexual pain disorder. So for treatment, cognitive and behavioral psychotherapy with systematic desensitization and deep muscle relaxation techniques. Vulvovaginal atrophy leading to pain. Then you use topical estrogen formulation, few weeks of treatment and taper depending on symptom. Androgen level continues to decrease in reproductive women until menopause, at which point no more decrease is observed. Transdermal testosterone FDA approved for treatment of hypoactive sexual desire disorder. 6 months trial should be used with testosterone monitoring 4 weeks out, and every 6 months if continue using. Side effects: hirsutism up to 20%, acne, virilization, cardiovascular complications. Testosterone combined with esterified estrogens decrease LDH and decrease triglyceride. And then breast cancer, non-significant increase in number of invasive breast cancer. Low dose vaginal estrogen is preferred hormone treatment for female sexual dysfunction due to menopause. Ospenaphine can be an alternative. It's a selective estrogen receptor modulator with an agonist to the GU system and antagonist to the breast. It causes hot flashes. Non-hormone medication or devices. Flubanserin is a serotonin receptor agonist antagonist. Low effectiveness, risk of syncope and hypotension when drinking alcohol. Bupropion, higher desire, arousal, and lubrication. 150 milligrams BID. Pain or penetration disorder. Vaginal estrogen, lubrication, physical therapy, dilator, medications. You can use intravaginal progesterone or DHEA. Preparation, postmenopausal, is for postmenopausal women with moderate to severe dyspareunia. Vaginal carbon dioxide fractional laser treatment. It's now FDA approved.